Hello, once again, everyone. This is Tuhin. I have around 10 years of experience. No, this is Tuhin. I have 10 years of experience in engineering. And again, we have an esteemed guest, my sister, who is a child psychiatrist. To go into the details, she is MD, she is DNP psychiatry and PDF in child psychiatry. So if you have missed our previous episode, please go through that. And without any further delay, let's start, Dr. Jigyansa. So, in our engineering world, like in layman terms, can you actually tell us the difference between anxiety, stress, and depression?
Yeah. Uh, so stress is something which is usually um, a cause or something that causes a lot of distress within your body. So what do I mean by that is, for example, you're hungry. That can also be a stress. That's something called a physical stress. But what happens is when you're exposed to a particular form of stress for a long period of time, or if the stress is something which you're not usually exposed to, like for example, it was an examination, for example, a very competitive examination. So you're not exposed to that kind of a pressure. So that kind of a stress is something which is unusual, and that can provoke certain reactions in your body. And that stress can be acute or chronic. So usually in terms when we are exposed to certain situations like that which are stressful, that can lead to certain point of time. If you're talking about the mental health status, it can lead to anxiety and depression. Where anxiety and depression can happen to normal people. Like every person can be anxious at times. I feel anxious. I'm not sure what's going to happen. I feel depressed. I feel sad. I don't feel like going to work today. I don't feel like going to school today. So those kind of feelings are quite normal. So anxiety is something which can be a day-to-day emotion. Depression is also something which can happen every day, and that's like how you feel with it. It's an emotion, right? But when we talk about anxiety disorder or depression as a clinical entity, that is much beyond what everyday people experience in anxiety and depression. And that's the clinical diagnosis. That is when anxiety persists for 6 months. It does not get better. Every single day you're experiencing the same symptom. You're not able to focus. Everything in your life starts getting controlled by anxiety, or you start avoiding things because of anxiety. That then only we say it is an anxiety disorder and start treating. There are a variety of anxiety disorders depending on what are the nature of symptoms and what is the stressor. Similarly, depression, when it is like, suppose you had a breakup, obviously you're supposed to feel sad. You're not supposed to be happy, right? So that sadness, if it is there and if you're able to manage it, I think it should get better in maybe 7 days or 10 days. You should be at least functional, right? But if you're not able to be functional, you're starting to stop going to college, work for at least 2 weeks. So when we say it is beyond 2 weeks, or you start experiencing suicidal thoughts, you start experiencing thoughts of harming yourself, you start hearing voices, seeing things. So those kind of things when happen, we say it is a clinically significant depression, and we say it is a major depressive episode. And those are the points where you should be starting to seek treatment.
Okay, but as a normal person, when I work for more than 12 hours, I have to work to complete my project within the deadline. So, and if it is happening over sometimes it is over a couple of months, maybe 3 months. So how can I diagnose like myself? Like, should I meet a doctor or someone?
Definitely, always you do not need to meet a doctor, but yes, you can try, like self checklist. So yeah. So how is my mood status? How am I feeling? The predominant something that we call as a journal. So what you can do is you can document if you feel that you might be dealing with something like anxiety or depression, which could be a clinical condition. You can start by making a journal or start by noting down the way you feel, preferably every day at least once. So what is your predominant mood like? Um, is there anything that you're not able to achieve because of this particular mood state? For example, I feel low, I don't feel like going to work, I feel like lying on the bed the entire day, and that is why I'm not able to push myself to even go to work or push myself to even go and brush my teeth. So if those kind of symptoms keep happening, there is a functioning impairment, right? And that is almost there, persistent and pervasive. The entire day you feel like the same. So if these are the things which are there, maybe you should see a doctor. And there's some danger signs or some red flag signs. If that is happening even once or twice, then also you should see a doctor. For example, thoughts of harming yourself or suicidal thoughts, or maybe actually you had harmed yourself some point of time. Sometimes people tend to use alcohol, use smoking as a way of coping with their difficult emotions. So if you're resorting to those kind of maladaptive coping strategies, it's good to seek help early. Because if that is just a coping strategy, you can have other coping strategies also by talking to a professional. So I think those are the points of time you should start seeking help.
Got it. Okay. So, do you think engineers think differently about the mental health?
Um, I would not stereotype engineers per se to be thinking differently about mental health, but a lot of people today who are educated, they're working, they're independent, they do experience similar sort of difficulties in how they manage mental health. And yes, engineers do adopt that style as well. But when we talk about engineers in particular, they are supposed to have a scientific bent of mind, a lot of problem solving there, yeah, the problem here, how to problem solve, they use different strategies, all of that they keep doing. So yes, if we see it like that, they see a mental health issue as one of their bugs, or, maybe a virus to be tackled. So something like that. And they try to have five different things. I'll do this, and see if it is working. So, yes, it helps. If it is not a clinical condition yet, if it is not a syndromal depression, not very severe depression or severe anxiety, it usually helps. And if there are certain techniques that are helpful, yes, that's fine. But I think what engineers or a lot of educated people even today say, that they say, I can manage things myself. I don't need to go to a psychiatrist here. So that kind of a thing is very there. And they're like, and they consider seeing a psychiatrist or seeing a psychologist person or seeing any mental health professional, they consider themselves as a failure, that I am not able to manage it. And that is why I'm seeking someone's help. So they see it as a failure. I think that is something which is wrong, because obviously in the engineering line also, you must be having people who are senior to you, someone as senior developer, a senior manager, who are better trained or maybe experienced in dealing with certain issues, and you go to them for seeking help, right? So similarly, if there are mental health issues, there are professionals available. I think it should be as simple as, and definitely not stigmatize seeking help, and it should be seen as a sign of wisdom and one of the problem solving steps. Yeah, I'll do three steps, and if it is not working, I'll go and see a psychiatrist. I think that is how it should be. So that is how their brain is already equipped into the problem solving strategies. So adding a line there is something that I could just recommend. Where you want to put it is completely up to you. But yes, if you are seeing a professional, that does not mean you are a failure. I think that's a sign of wisdom and bravery.
Okay, great. Thanks. So, uh, the curse of overthinking in a technical mind and the analytical thinking, like as you have already mentioned, but is it a curse for overthinking for technical minds?
Yes.
Because,
I think the question is very pertinent, because a lot of people who are engineers, who have a scientific bent of mind, they tend to overthink. I'm not saying overthinking as actually labeling it as more thinking, but because they tend to keep analyzing their problem, thinking, yeah, if I try a different problem solving strategy, possibly it will work out, right? So that is where they actually keep trying. So I think what is good about it is you're still trying. So I think I would like to respect that and keep the positive aspect in mind. At the same time, what is important is overthinking is not always bad if it is not draining you off, right? Suppose, for example, I got this analogy recently. Suppose you're having a memory leak, right? And what you do, you're adding one more CPU, yeah? So that does not work. Like similarly, suppose your blood, there is a cut here and there is active bleeding. There's an artery which is already bleeding. Instead of trying to fix it, what you're doing is you're loading more blood, right? So that is also going to flow away, right? So it is like that. So maybe the strategy might be helpful initially, but yes, if it is not working. So that gives you more data to help you understand this strategy is not working. I need to try something else. And this retrying it again in the same way is again going to lead the same results. So I would say overthinking is not a curse per se, but if used differently, that itself can be your biggest weapon. Yeah. So that is what I would say. But how to channelize the overthinking? Maybe you might need some help there.
Okay, got it. Okay. One more, just like a doctor and engineering question. Do you think an anxious mind runs in an infinite loop?
Oh, anxious mind. Yeah, definitely. Yeah, yeah. I think that is the best way to put it. Um, uh, Let me try to simplify it further, right? For example, what happens in anxiety is like anxiety is a normal human response to any sort of danger. For example, I see a tiger in front of me. So yes, my amygdala is there in all of us, right? It is the center that triggers fear or anxiety kind of responses. It is to protect you from any danger, right? So my body will say there is danger in front of you. You either need to run or fight, right? So your body starts going to that mode. So whenever there is something which is dangerous in front of you, your brain starts doing that. What happens in anxiety, or what happens in an anxiety mind or an anxious brain, is that you start perceiving every small thing in and around you as a possible sign of danger. For example, you failed in exam once, or you failed in this interview once, and what happens is possibly I'll feel the next time also. Seeing the site of the interview, seeing that room where people are waiting, or even meeting another person who talks about the interview can trigger that kind of a response, a similar kind of response that is triggered when you see a tiger, right? And your brain does not know how to differentiate it, and that is what is the anxious problem. So that loop is there, and that is very, very biological, that is deeply rooted, that you cannot change that. So that cycle comes, and then you again start feeling threatened. And once you're hyper startled, you start seeing everything again as more danger, more danger, more danger. So that loop never ends. There is nothing to help you calm down, because only after you're out of that place, maybe actually you're safe, then only you might be feeling a bit calm down. So the only way to come out of it is, yeah, sit in your home. That is the only place you're safe, because you're not going to see an interviewer, you're not going to see your friends. And that cycle keeps on continuing, and your brain starts getting reinforced saying that only if I am at home and I'm not attending an interview, that means I'm safe. So, yeah, if that analogy helps understand what you asked.
Okay, so take a break.
Yes, I
Take
think taking a break and telling your mind, and how to take a break is also something that we have learned over periods. It helps is like regulating your breath, because your breath gives you a feedback. How fast you are breathing gives you a feedback how dangerous or how safe the situation is. For example, I'm frightened, so obviously my heart rate is going to shoot up. I might you might start hyperventilating. So that again triggers your brain saying that, oh my god, that's the danger is still persisting, and then that cycle keeps on continuing. So how you can break it is, everything is okay. Let me take a break. Taking a deep breath in and deep breath out, preferably through your abdomen and not your chest. So you can put one hand on your chest, one hand on your abdomen. Try taking a deep breath through your abdomen, which we call as a diaphragmatic breathing, and not breathing through your chest only, right? And there's a strategy called 4-7-8. Like you count 1, 2, 3, 4, breathe in, hold 1, 2, 3, 4, 5, 6, 7, and then breathe out 1, 2, 3, 4, 5, 6, 7, 8. It's called the 4-7-8 strategy. The actual basic behind it is the expiration has to be longer than the inspiration. So as long as you're doing that, your parasympathetic system takes an override over the sympathetic system, and that is how you start feeling calmer. So that resets the infinity loop to saying that it's safe, you can be okay. So that is how it works.
Okay, got it. Um, so you said one of the mental debugging techniques. Do you have more of them?
The strategy is like this, like the deep breathing technique. Yes. So when we talk about anxiety, there are different relaxation strategies. The term that we use for these kind of activities, and this works primarily for anxiety and anxiety disorder or anxiety situations. You do not have to be diagnosed with an anxiety disorder to start practicing it. It can be in any situation that makes you anxious. Start doing it, it works. The first is deep breathing. The second technique that we usually say, it is a bit, I would say, a prolonged version of the same. It's called the JPMR. JPMR is Jacobson Progressive Muscle Relaxation. There are a lot of videos out there on YouTube where you can find a lot of videos where people have given the steps about how to proceed with that. It is usually from 20 to 40 minutes, and that is usually practiced at home. Obviously, in the office setting, you cannot do it. Right? Another strategy for it, for deep breathing, is a box breathing technique. The one that I said earlier, that is a 4-7-8, is a bit difficult to practice if you're extremely anxious. So what you start saying is a box breathing. 4 second breathe in, 4 second hold, and 4 second breathe out. So that also works. 4-4-4. So that will also work. You can try that. Another thing that you can do at that point of time is holding on to something which is cool or cold. How does that work? I'll tell you. For example, when you are anxious, um, or angry, right? Suppose you're anxious or angry. What happens? Your temperature shoots. Okay? Maybe your hands and thing maybe a bit cold, but your entire body temperature shoots up. Your basal metabolic rate goes up. So what you can do is, if you're at home, you can take a cold shower. That also helps you calm down. Okay? So there are a lot of different strategies like this which you can do on day-to-day basis to keep yourself calm. Non-medical techniques like use of meditation, yoga, and some sort of physical activity, any sort of physical activity or physical exercise for 30 to 40 minutes a day also helps in increasing the endorphin and the parasympathetic system, which also helps you remain calm. So yeah, so those are the techniques that you can use. If that does not work, there's still a lot more. Maybe I'll share a checklist with you, and you can put it in the description for our viewers to have a look.
Sure, I'll do that. Okay. So, if someone wants to contact a specialist like you, how can they do that?
I would recommend a physical consultation for everyone around there. Physical consultation by mean walking into a clinic and like having an appointment and having a word. But if at all that's not feasible, there are a lot of online websites and platforms where we have a lot of specialists who provide online sessions as well. So reaching out to them and then requesting for online session if that does not work with your work schedule and all of that. So a lot of people are actually willing to accommodate. So I think connecting them, you can find it all over the net. Search for a psychiatrist or a clinical psychologist. So, yeah. So to start with, you can connect them
So, what is
on
the
internet.
difference between a psychiatrist and psychologist?
Yeah. So basically, a psychologist, how they reach to that degree is a bit different. For example, a psychiatrist is a doctor basically. They have done MBBS and then a specialization, master's or MD in psychiatry. So they are doctors, so they can prescribe medicines in addition to doing what the other things a psychologist can do. A psychologist is basically trained in the basic sciences or arts, and then they do a BA, MA, and then MPhil in clinical psychology. That is when they become a clinical psychologist. Most of them who do not do a MPhil in clinical psychology, they do a basic course in counseling psychology after MA. So they can be called as counselors. So they can help you with maybe ventilation sessions, supportive therapy, relaxation exercises. And some of them do intensive therapy as well, like cognitive behavior therapy and all, but they cannot give you prescriptions. So doctors, like psychiatrists, can do all that psychologists and clinical psychologists do, plus prescriptions. So that is the added advantage.
Got it.
Yeah.
So,
And for
thanks
a
a lot.
clinical diagnosis, also maybe it's better to see a psychiatrist that way. And most of the cases when there is a medical comorbidity, people come by abusing substances and all of that. So they might need a lot of medical angle to it. So it is better to see a psychiatrist then and then go to a psychologist when referred. That's how it works.
Okay, great. Thanks again. And for our viewers, if someone is not comfortable coming out directly, please put your questions in the comments. And in the next session, I'll make sure to ask them to our specialized doctor who can actually answer on them and give a proper direction for them on how to proceed. So once again, thank you, Dr. Jigyansa. and let's hope.
It has been a pleasure. Thank you so much.
Yes, thank you. Thanks a lot. See you.
Okay, bye bye.
Bye bye.